Assalamu alaikum warahmatullahi wabarakatuh. I'm Miss Ulfat Amin, PG Pediatric Nursing, Diploma in Nursing Administration, and today I'm with part fourth of previous video, that's nursing theories. And today I will be discussing Virginia Henderson's need theory. First of all, background of the theorist. Virginia Henderson was born on 1897 in Kansas City, Missouri. She got her A grade diploma from Army School at the age of 24 in 1921, earned her bachelor's degree in 1932 and master's degree in 1934. She is a well-known educator and an author. She is known as Nightingale of modern times because of her theory, which is developed from the definition of the nursing given by her. In 1966, Handerson's first definition of nursing was published in Bertha Hermann's revised nursing textbook, and she was one of the first nurses to point out the nursing does not consist of merely following physician's orders, but she describes the nurse's role as substitutive, doing for the person, supplementary, helping the person, complementary, working with the person, with the goal of helping the person to become an independent person as early as possible. Her famous definition of nursing was one of the first statements clearly delineating nursing from the medicine, which is the unique function of nurse is to assist the individual, sick or well, in the performance of those activities contributing to the health or its recovery or to a peaceful death that he would perform unaided if he had the necessary strength, will or knowledge, and to do this in such a way as to help the individual gain independence as rapidly as possible. Two events are the basis for the development of a definition of the nursing by her, and these are: first, she participated in the revision of nursing textbook during a revision of the text book, that is Principles and Practices of Nursing, written with Bertha Herman in 1992. She realized that the need to be clear about the functions of the nurse, and second was concerned that many states have no provision for nursing licensure to ensure safe and competent care for the consumers, as many nurses were giving care without the licensure. Henderson's focus on the individual care is evident in that she stressed assisting individuals with essential activities to maintain health, to recover, or to achieve peaceful death. She proposed 14 components of basic nursing care of the patients, or we can say, as per her, there are the 14 basic needs of a patient that are divided into different subheadings. Like, first is the physiological needs, which includes breath normally, eat and drink adequately, eliminate body waste, move and maintain desirable posture, sleep and rest, select suitable clothes, dress and undress. Maintain body temperature within normal range by adjusting clothing and modifying the environment within which the person is living, and keep the body clean, well groomed, and protect the integumentary system. Psychological needs of the humans, or like communicate with others, express emotions, needs, fears or opinions, learn, discover or satisfy the curiosity that leads to the normal development and health, and use the available health facilities. And the different spiritual and social needs are like worship as per one's faith, work in such a way that there is a sense of accomplishment, play and participate in various forms of recreation. Now the meta paradigm. First, if we talk about the person is an individual who are having the basic needs, or that are the components of the health, and individual is requiring assistance to achieve health and independence or a peaceful death. And it's the person who considers the biological, psychological, social or spiritual components, and the theory presents the patient as a sum of parts with biopsychosocial needs, and the patient is neither a client and nor a consumer. And as per Henderson, environment is a setting in which an individual learns unique patterns of living, or all the external conditions that influence or affect the life and development of an individual. Society wants and expects nurse to act for individuals who are unable to function independently, and in return nurse also expects to contribute to the nursing education by the society. And the basic nursing care involves providing conditions under which the patient can perform all the 14 activities without any assistance. And health, as per Henderson, is individuals' ability to function independently, and nurse needs to stress on the promotion of health, prevention of health, and cure of diseases. Health of the individual is affected by age, culture, background, socio-economical factors, physical and intellectual capacities, and emotional balance of the individual. And health is the individual's ability to meet these needs independently. And nursing, as per Henderson, is temporarily assisting an individual who lacks the necessary strength, will, or knowledge to satisfy one or more of the components of the basic needs. And nursing is the assistance and support given to the individual in different life activities, or we can say in the different daily activities for the attainment of the independence. And a nurse serves to make the client complete, whole, or an independent person. In the nature of nursing, the nurse is and should be legally an independent practitioner and be able to make independent judgments as long as she is not diagnosing, prescribing treatment for the disease, as making a prognosis for these are the physician's functions. So, nurse should have knowledge to practice individualized and human care and should be a scientific problem solver. If we talk about the nursing process and Henderson's theory, Henderson views the nursing process as really the application of the logical approach to the solution of a problem, and the steps are those of the scientific method. First step includes nursing assessment. This step focuses on 14 components of basic nursing care like breath, normally, sleep and rest, eat and drink, etc. And next is the nursing diagnosis. In this, nurse identifies individuals' ability to meet their own needs with or without assistance. And in the goal, what she does, she document how the individual can perform his or her own activities. And interventions, she assists an individual to perform all those activities, help him to meet his needs and recover from illness or to a peaceful death, and carry out the treatment that is prescribed by the physician. Then she evaluates how well the individual is able to do his activities or meet his needs without the assistance. Thank you. This was all about this theory. See you soon with the next topic. Allah Hafiz.